From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice.
Hello, and welcome to this edition of the JAMA Clinical Reviews podcast. I'm Dr. Kirsten Bibbins-Domingo, and I'm the editor-in-chief of JAMA and the JAMA Network. I'm joined today by Dr. Katrina Donahue. She's professor and vice chair of research at the University of North Carolina at Chapel Hill in the Department of Family Medicine. Dr. Donahue is a family physician and senior research fellow at the Shep Center for Health Services Research. She is also the co-director of the North Carolina Network Consortium, a meta-network of 6 practice-based research networks and 4 academic institutions in North Carolina. Dr. Donahue is a member of the U.S. Preventive Services Task Force, and this week, JAMA publishes the task force's recommendation on screening for skin cancer, as well as the evidence report on which the task force recommendation is based. Dr. Donahue, welcome, and thank you for joining us today to discuss this recommendation.
Oh, thanks for speaking with me today. I'm excited to be here talking with you about skin cancer screening.
Wonderful. So why don't we jump right in? And why don't we begin by telling us what the task force is recommending? What does the evidence tell us about screening for skin cancer?
Certainly. Skin cancer is the most commonly diagnosed cancer in the United States. After reviewing the research on screening for skin cancer in primary care, the task force found we don't have enough evidence to tell us whether or not screening people without symptoms is beneficial. This is an I statement, which means we don't have enough evidence for people who don't have any signs or symptoms in primary care. An I statement is not a recommendation for or against, it's a call for more research.
Great. So let's unpack this just a little bit more. So you told me that skin cancer is the most common cancer. There are a variety types of skin cancer. How serious is skin cancer as a threat to health?
Yeah, skin cancer itself, it's basically an abnormal growth of skin cells. And there are 2 types of skin cancer, melanoma and keratinocyte carcinoma. Melanomas represent 1% of skin cancers, and they cause the most skin cancer deaths, with an estimated 8,000 Americans dying from melanoma this year. Keratinocyte carcinoma is less likely to cause morbidity and mortality, and it's common and usually curable.
So skin cancer is one of the most common types of cancers, but the type that causes death is melanoma, uncommon amongst the skin cancers.
That's right. Skin cancer is the most commonly diagnosed cancer in the United States. However, most skin cancers don't cause serious complications or death.
Okay, but some do. And with melanoma, we'd presumably like to find it earlier. And that usually is the basis for thinking about screening as a way to help us to identify a disease process earlier in order to help ideally change the trajectory of that process. So what is the problem with screening, even if it's just to find something like a melanoma?
For screening, the task force looks at first, whether screening can decrease morbidity and mortality from skin cancer. And unfortunately, we don't have that evidence. We have evidence from 2 screening programs with some more follow-up data, but the populations are not representative of the United States. Backing up a little bit, this recommendation is consistent with the 2016 recommendation, but we just don't have enough evidence here. So when we don't have the overall evidence, we looked at the indirect pathway. And here we look at the skin exam. So the skin exam in primary care, is this adequate? We found that skin exams in primary care are adequate for detecting skin cancer, such as melanoma. However, we don't have consistent association between screening and early detection of skin cancer or precancerous lesions.
So overall, you're looking for whether screening, on the one hand, whether there's studies that directly address whether the screening actually leads to decreases in health complications or death from this condition, in this case, skin cancer. You didn't have enough studies to really tell you that overarching question. So then you break it up into a bunch of smaller questions. And here you're looking at, does the skin exam actually find the lesions? And then does finding those lesions early help lead to a reduction in morbidity and mortality?
That's exactly right.
And what you found was that you didn't have it for the first one, but the second one, the screen is pretty good, but it doesn't lead to actually changing the morbidity and mortality. Is that how I should understand it?
Yeah, the skin exams in primary care are adequate for detecting the skin cancer. However, we can't find evidence. We don't have a consistent association that screening can find that skin cancer early to make a difference. So that's where we're stuck.
I see. And the screening tests we're talking about here are really the skin survey, taking a person who's not coming in complaining about a mole, but rather taking a person who is not complaining about anything, really, and that a primary care doctor, a clinician, is routinely doing a skin survey in order to identify lesions that might be problematic.
Yeah, and you raise a good point. This recommendation applies to adolescents and adults who don't have signs or symptoms. It doesn't apply to people with a personal or family history of skin cancer or symptoms such as an irregular mole. A primary care professional can look at a person's skin from head to toe, looking for moles or spots that look abnormal in color, shape, texture from the rest of the skin. But we don't have enough evidence on the effectiveness of screening for skin cancer in primary care to recommend for or against screening in people who don't have signs or symptoms.
So this is always the question with an I statement. Does this mean we shouldn't do it? So if a clinician does routinely do this as a part of their practice, is the statement here telling them they shouldn't do this?
Yeah, this is an I statement. It's not a recommendation for or against screening. It's a call for more research. However, we always encourage people who have concerns to talk with their clinician about what's right for them.
What kind of studies do we need? What research would actually help close the gap here?
So, we need consistent evidence showing that screening is effective in detecting skin cancer early or reducing the number of complications or death from skin cancers, particularly melanoma. Additionally, we're calling for improved representation of persons of varying skin color in research studies to promote prevention, early diagnosis, and treatment of skin cancer in communities of color. Our current data is based on a population of European descent. So we are calling for more studies that represent a diverse population, as in a population of the United States.
One of the things that I learned in reading the evidence reports and the work of the task force is that fairer skin does put one at greater risk for skin cancer. So it would make sense that some of these studies would be in populations of European descent. But it is also true that there are higher rates of complications or mortality from skin cancer among darker-skinned individuals. And in fact, the location of the skin cancers is oftentimes not where one would typically look for them in darker-skinned individuals.
Yes, that's true. Fair skin or light colored eyes does put one at increased risk, especially increased risk to UV radiation from the sun, indoor tanning beds as well. But yes, melanoma is 30 times more common in white persons than Black persons. However, persons of color are often diagnosed with skin cancer at later stages when it's more difficult to treat.
So that really does speak to the task force's call for studies that are representative of the U.S. population as well, particularly for this recommendation.
Exactly. For this recommendation, there's limited evidence on the effectiveness of screening for skin cancer in all populations, including persons with dark skin. So we're using this recommendation to specifically call out for research on screening people with a wide range of skin tones.
So, while we're waiting for more evidence, what do we advise patients who might be worried about skin cancer?
In the absence of evidence, healthcare professionals first should use their judgment when deciding whether or not to screen. But for patients, I encourage all patients with any concerns to talk with their healthcare provider about their concerns so they get the care that they need.
Do you encounter this question in your practice?
Certainly, in practice, when we're going through the regular preventive exam, many questions come up, and there are many things that professionals can do in the course of a physical exam. So, when I'm with a patient, I'm assessing risk factors for skin cancer and for other cancers as well. But, probably the most important thing I would say is that we do have strong recommendations for counseling here. So, the U.S. Preventive Services Task Force recommends counseling young adults adolescents, children, and parents of young children about minimizing the exposure to UV radiation. And this is a B recommendation. So that's one I certainly counsel my patients about.
So if we're worried about skin cancer, we can use that time in the exam to talk about the things that a patient can do to prevent or reduce their UV exposure. And the task force, in fact, has a recommendation statement on that. And certainly, you've highlighted that patients who have a family history, this is not a recommendation that really applies to them. And it is also not a recommendation that prevents someone or discourages anyone from talking with their doctor about changes in their skin, changing in the color of a mole in particular. That should be something that would prompt the conversation and the appropriate clinical evaluation. This recommendation is really about the routine skin survey in somebody who doesn't have signs or symptoms of disease.
Exactly. Yeah, this is for the person who presents without any signs or symptoms. And of course, we encourage anyone concerned about a suspicious skin lesion to talk with their clinician so they can get the care that they need.
Wonderful. Okay, so what else would you like to tell our listeners, either who might be worried about skin cancer or who are clinicians trying to figure out what they should be doing in their practice?
Certainly. First, skin cancer is the most commonly diagnosed cancer in the United States. Unfortunately, we don't have enough evidence to know whether or not screening adolescents and adults without symptoms reduces complications or death. We encourage anyone who's concerned about a suspicious skin lesion to talk with their clinician so they can receive the care they need. And finally, prevention is key. We encourage you to protect yourself from UV light with sun protection and minimizing exposure to UV light.
Wonderful. That is an excellent summary. Thank you so much, Dr. Donahue, for joining me today to explain the task force's recommendation on screening for skin cancer.
Oh, thank you so much for having me.
This has been Dr. Kirsten Bibbins-Domingo, editor-in-chief of JAMA and the JAMA Network, talking about the new task force recommendation on screening for skin cancer with Dr. Katrina Donahue, a member of the U.S. Preventive Services Task Force.